now we're going to look at the characteristics linked to improved family quality of life. And so what characteristics of the family is linked to better satisfaction on family quality of life ratings? Vanessa, can you? Okay. So for this, we turn to the concept of resilience in families in particular. And resilience happens only when there's adversity. And so it's a concept that comes from an understanding in the research about how people cope with adverse events in their life. And here's one example of a definition of resilience, but there are others. Characteristics, dimensions, and properties which help families to be resistant to disruption in the face of change, and also adaptive in the face of crisis situations. Next slide, please. So resilience is not a global concept. That is, a family, is not defined as being resilient in every aspect of their functioning, but families can be resilient in certain areas or during certain time periods or events. And so in particular, we want to look at resilience because it tells us something about what's going right. So what are the strengths that are being identified, and what are the protective factors? And if we can learn something about families who show resilience, maybe we can share those strategies, and maybe it might help other families who are having a harder time adapting to difficult events. And so resilience then is this ability to develop optimally despite those exposures to really elevated risk or adversity. And even one could say, having a child with a disability could be seen as a risk factor because of all the additional needs and the additional challenges that a family faces. However, COVID-19 is more of an acute, well, now becoming more chronic situation of risk that we're dealing with. So this is a strengths-based perspective. It not only looks at all of the risk factors and all of the problems that families are facing, but it looks also at their ability to do well, even better than most. And what the strengths are for the families in these situations. And the family, of course, is always considered a system, a dynamic system. Things are always changing. Risk factors, protective factors are continually interacting with each other and constantly changing. And so we need to look at risk factors and protective factors generally for the family, but then also for specific events like COVID-19. And then we're also interested in the interaction between the child in the family as a whole, and the family within the community, and then all of the sort of social and environmental factors that impact a family's resilience. Okay, next slide.
Okay. Sorry. So what are the characteristics of families with high family quality of life? So first we'll talk about child characteristics. So families categorized as resilient were defined as those families scoring 3.5 or higher on the Beach Family Quality of Life scale. So again, the maximum score is out of 5. So these families that are resilient score 3.5 or higher. So looking closely at these families, we found that they tend to have children with fewer behavioral problems. This is consistent with the literature demonstrating that parents of children with more severe behavioral problems show greater levels of stress. They also might require more behavioral supports. Families with high family quality of life or resilient families, they also tended to have children with fewer mental health concerns. To illustrate this, one family with a high family quality of life commented, "My child is a calm, happy, easygoing person who is very articulate and grounded and emotionally stable. She's handled this all really well, better than her parents in some ways." Families with high family quality of life also tended to have children that were still, even in the pandemic, very well connected with their peers. So one parent shared, "We're really doing just fine. Our kid is happy, calm, and socializing with her friends online." Looking at family characteristics, we found that parent training and expertise was linked to higher family quality of life. So families with parents who had careers or background training in education, behavioral support, child development, they appeared to cope better. One parent identified this and said, "I feel that we have been very fortunate in terms of my career and training. His mom is very hardworking and good at organizing and working with him." Parent resourcefulness also appeared to contribute to better coping and resilience. Being able to find information on the internet or having extended family members help with childcare also appeared to contribute to resilience. So one parent commented, "We had to lean on every resource we had with family and friends to give ourselves a break from our son, since he is very needy and requires constant supervision." So similarly, having extended family and friends also appeared to contribute to better adjustment for families. So many parents highlighted the importance of just having a break once in a while and how important this was for their well-being. So one parent noted that without the support of family, parents, aunts, and sisters, we would have had very worse outcomes with our children. Another likely contributing factor related to having a stable income and living in a two-parent household. So some really insightful comments from parents in our survey mentioned that many of the solutions out there for supports are based on two-parent households, which are just not a reality for most families. So when designing these programs and interventions and supports, we need to be aware and considerate of these factors. And I think we've learned from this data that services and supports need to be designed and delivered in ways to accommodate the diversity of a family's needs and also the realities of their lives. So considering families with multiple children with disabilities, single parent households, children with co-occurring physical and mental health support needs as well. And this graph here shows that family quality of life ratings for families that fall into each of these different categories on the x-axis here. So compared to families where there was no impact of the pandemic on their family income, so this bar here, when we compare this bar with the severely impacted families, in terms of their family income, we see a significant difference and specifically a decline in their family quality of life. So this suggests that it's important to look at the financial impact on families. We shouldn't ignore this as it does appear to play a role in determining their family quality of life. And now turning to government supports that were found helpful or that families were able to access, those families that were defined as resilience. The results show that families who perceived flexibility in funding and were able to use their funding in ways that were congruent with their family's needs showed higher family quality of life and resiliency. So one parent commented, "I was very grateful to be able to use 35% of funding and sign the forms as a parent. We know what our kids need. Using a professional that is unfamiliar with the child just causes more anxiety and often costs hundreds of dollars." Parents that were able to access respite also showed higher family quality of life. So some directly attributed better adjustment and high family quality of life to their access to their access to respite. So one parent shared, "We were fortunate to still receive respite funding during this time, and that was greatly helpful to us." Parents able to use their funding for exercise or technology equipment also demonstrated higher family quality of life. So one parent commented that being able to get equipment for my son without having to get a signature from a professional was extremely helpful, as I usually do not have access to a service provider that can do so. Also, the increased flexibility of use for the directly funded respite was helpful, as I could not use the funding within its usual requirements. Now looking at school support characteristics that were related to high family quality of life. So these are some characteristics that were found helpful for families that were defined as resilient. So having consistent communication with teachers and school staff. Families that reported this as a strength were more likely to be defined as resilient. So one parent was quoted as saying, "Teachers checked in and provided weekly lesson plans, which I was able to build upon to ensure my child was learning at a similar pace as before." Resilient families typically had educational assistance being available to support their child's learning. So one parent mentioned the daily check-ins with his EA were essential for him to stay connected to school. So many families appreciated having this. Resilient families identified that having schools connect them with educational supports and resources was also found to be helpful. So for example, one parent said, "Our school is very supportive. As soon as I contacted the special needs resource coordinator, she did what she could to involve my child with the school resources." And an ongoing theme of this presentation, I think, highlights the importance of mental health supports. So families demonstrating resilience during this pandemic appear to access mental health supports for themselves and their children. So one parent shared, I encouraged my son to have counseling to help him balance his hormones and mitigate depression and anxiety. So these families do not just access mental health supports, but they appear to prioritize this area and take proactive steps to improve their mental health and well-being. So these resilient families, they recognize the signs of mental health deterioration, and they take action to improve or mitigate stressors on their mental health. So one parent shared, "We did reach out to mental health services as we are not trained to support our son in the ways he might need. Reaching out before there is any sign of trouble is what we think is best." Accessing individual and family counseling also appeared to enhance resilience. One parent said, "The appointments with his psychologist and family counselor have helped him with these concerns. Again, those supports have been critical for us." So the data suggests that it's not that these families with high family quality of life or these resilient families have no mental health concerns. The results actually show that they do, but they're reaching out for supports and seeking help before they reach a crisis situation. So these findings indicate that it should be a priority, and it's important to reduce barriers to mental health access. And I think a positive to come out of this pandemic is that there have been more virtual mental health supports and more capacity in this area than ever before. And this has largely been an untapped resource before the pandemic, these virtual supports. And I think we're coming to learn now how valuable these resources can potentially be, especially in remote and rural areas post-pandemic. So this graph here shows the relationship between parent anxiety here on the x-axis and the overall family quality of life. So what we can observe here is a negative relationship where less anxiety symptoms are linked to or are correlated with improved family quality of life. So again, this is a correlational relationship, so we don't know the direction of this relationship, but we do know that they're significantly related. When we conducted a regression analysis, which estimates the relationship between a predictor and an outcome variable, we found that after controlling for demographic factors, with all these things even, parent anxiety significantly predicts quality of life. The implications of this are that targeting mental health, specifically parent mental health, can potentially improve quality of life. And here we have graphed, again, a correlational relationship between parent mood on the x-axis and the overall family quality of life on the y-axis, and we observe a positive relationship. So the better the parent's mood, as the parent's mood increases, so does their family's quality of life. Again, this is a correlational relationship, so we don't know the direction. However, when we conducted a regression analysis to measure or to estimate the relationship between parent mood and family quality of life, we found that parent mood significantly predicts quality of life. So similar to the previous graph, these findings suggest that targeting parent mental health, their anxiety symptoms, their mood, can improve family quality of life. And these findings that we've presented so far potentially gives us clues as to where we might want to prioritize interventions and supports based on parent recommendations, their comments that show their perceptions, as well as what we see with the quantitative data that we've collected.